If you have questions about hormone imbalance symptoms, you're in the right place. I'm Dr. Serrano, and I run and operate one of the busiest wellness clinics in my town. And the whole core belief that we have is that God needs no help to heal. He just needs no interference. So before we get going, if you have questions about hormone symptoms and hormone imbalance symptoms, I'm going to share with you 3 steps you can take to start rebalancing those hormones. But before we do that, quick little plug. If you haven't seen or got a hold of my book, The 14-Day Reboot, go pick up a copy. In the book, this is the system that I use with my patients to help them rebalance their hormones, detox their body, and give them the jump start they need to start losing weight. So one more thing, go ahead and subscribe to this if you like the video, and put any comments or questions you have right below. I want to answer these questions for you. So if you have questions, I want to help you. I want to answer those for you guys. And one more thing, if you enjoy this, share it. There's so many people out there that are looking for answers. They're looking for hope. They're looking for something else other than the medical system that's just giving them another drug, another medication, and just never truly getting to the cause. So let's jump in. As I was preparing for this, I see hundreds of patients in my office, and one of the things I've done recently is I asked, when you're looking for hormone or symptoms or imbalances, what were you searching for? And here's literally some of the key terms or keywords they were searching for. They searched for things like hormonal headaches, hormones balance, hormones weight gain, or even search for hormones for weight loss. And what I did is I said, let me search for hormones and symptoms. So hormone imbalance symptoms, and this is the list that came up. Unexplained weight gain or weight loss, unexplained or excessive sweating, difficulty sleeping, changes in sensitivity to cold and heat, very dry skin or skin rashes, changes in heart rate, changes in blood pressure, brittle or weak bone, changes in blood sugar concentration. This is an insulin issue, which we'll chat about. Irritable or anxiety, depression, unexplained or long-term fogginess or fatigue, changes in appetite, bloating, headaches, reduced sex drive, thinning or brittle hair, infertility, puffy face, and the list went on and on and on. So if you're watching this, I want to give you some answers. And the reason I go through that list of symptoms is because what happens is when you mess with your hormones, when your hormones are out of balance, your whole body can be out of balance, and then you start to experience a host of symptoms, and we don't even know where to start. If you were to go to the doctor's office and have your blood work done, and your hormones are out of balance, typically what the common treatment out there, it's just to do hormone replacement or just to treat the symptoms, because that's what hormone replacement therapy is. Hormone replacement therapy really is just dealing with the symptoms. It's never getting to the cause. And here's the exciting thing. I want you to know that you can heal. I want you to know that your body has the ability to heal. The best way I can explain this is, think about this morning, if you were shaving and you nicked yourself on your leg shaving. What did you have to do? Did you have to do for you to heal? Did you consciously have to think, oh, heal up, heal up, heal? No, you didn't have to do anything. Your body healed. Why? Because God put an amazing healing power inside your body. Now, here's the question you should be asking, or at least thinking about. If your body can heal a cut on your leg, why is it not healing these hormonal imbalances inside our bodies? And the question or the answer is, it's because something's interfering with that healing process. There's something that's stopping or blocking the healing from occurring. And instead of just, you see, I deal with 2 types of people in my office typically. And number one is it's the patient who they've been on medications. You've already been to the doctor. They've given you the medications, and now you're just tired of it. You know that there's other answers. You know there's something else, and you're just searching for answers. Well, we got those. The second type of person I typically see, it's the person who just got diagnosed or has been told that, yes, their hormones are out of balance and they've been given the medication, but they haven't taken it yet. And before they take it, they're going to try everything else before they get on the medication. This is the good step, by the way. So with that, there's a couple of things I want to explain. One thing in particular to you on how to, uncover or how to start rebalancing your hormones. Now, I don't know if you've seen my other videos, But the way you're going to heal a hormone issue or hormone imbalances is through this lock here. And you're thinking like, what does that lock have anything to do with my hormones? So basically, you have a key and you have a lock. And your hormones, they essentially work like this lock and key arrangement. What do I mean? So let's say that this lock here is your cells. And I'm going to talk about the hormone insulin. If this is your cell, the key would be insulin. This would be the hormone, right? And then the lock would be the cell. And for insulin to speak to the cell, it has to attach. There's a receptor site it has to attach to. So it would come in here and it would attach or go in. It would open up the lock or the cell. The cell opens up and guess what? Now sugar or glucose could get into the cell and it could be used for energy. That's essentially how insulin works. That's essentially how all hormones work in your body. There's a hormone and there's a site where it works on, and then your body has the proper response. What happens? What happens in our body is typically you have some gunk or some junk or some gum that blocks the site. So now you have this cell, you still have the hormone, and you have this cell, and now the cell or the hormone insulin is going to come up to the lock or the cell, and it's going to try to get it to activate, to open up. And what can I not do? If there's gum there, what can I not do? I can't communicate. It doesn't matter how much insulin your body makes. It doesn't matter how much estrogen, progesterone, thyroid hormone. It doesn't matter because there's a blockage or there's gum at this receptor site. So the couple things that cause these receptor sites or damage these receptor sites, and I want to walk through what are some of the things you can do to start taking the gum off and start rebalancing your hormones so that your body can communicate, open up, and start healing again. That's how you unlock health in your body. That's how you rebalance hormones. So I'm going to go through 3 steps with you to do that. Number 1, first step is we have to implement a hormone-based eating plan. Have you done that? You know, I have a lot of patients who try keto diets, who try the Whole30. They've tried Weight Watchers. They've tried counting points and calories. All that, they might lose some weight, but eventually what happens? A lot of it comes back. Why does it come back? It comes back because they never implemented a hormone-based eating plan. That is step number 1. And in my office and in my book, the 14-Day Reboot, that is exactly the plan that we help people. It's a system. It's a system. And am I saying that in 14 days, you're going to rebalance every hormone in your body? Your body's going to have no symptoms? No. What we say in the book and what I go through is that in the first 14 days, we can give you that jump start you need to start on the path to rebalancing those hormones. And in 2 weeks, you're going to feel so great. You're going to have so much more energy that now we're going to have the start of the system to start the lifestyle you need to actually end up rebalancing your hormones, getting your hormones back, unlocking your health, and being healthy again. So that's step number 1. Implement a hormone-based eating plan. Number 2, it goes along with number 1, is we must control insulin. You must control insulin. See, insulin is one of those key hormones. Hormones in your body, they all work together. They work together because when your insulin spikes, your insulin starts to go up, you also start to release a lot of other hormones, or you decrease other hormones. So as you control insulin, guess what? You start to rebalance your hormones. That imbalance in your hormones starts to take effect. And then the third part is you have to deal with the toxins. These hormone receptor sites, I told you there's a couple of things that damage these sites that don't allow your cells to open up or don't allow your body to communicate very well. And the things that damage these receptor sites, there's 2 main things. Number 1 is too much sugar over time, which causes insulin issues. That damages receptor sites. And toxicity. Toxins in your body literally mimic hormones, so they would block it off. Or it can cause some damage there that don't allow your body to unlock and actually be healthy. So with all that said, go to the 14-Day Reboot. I have you can get a copy of my book at the 14dayreboot.com. And I've also put together a couple of videos. Go to drserrano.me. There's a ton of videos on there on hormone rebalancing, and how to unlock health.